Hey, I am Mary Ann Munkers. I live in Lexington, Oregon, a little town in eastern Oregon. I do professional rodeo, and many of the professional rodeo athletes that I know of that are my age, and they are interested in keeping their health up throughout their whole life, and you have to be extremely healthy to do what we do. So several of my friends have done it either out of the country, in Canada, Mexico. But my latest friend said she was doing it in the United States, and that's when I discovered it was here. And we researched it online and found Evergreen Clinic.
With her background of growing up on the ranch, the farm area, lots of pesticide use, lots of those heavy metals that we know are not beneficial to our body, and long-term exposure definitely leads to a lot of chronic illnesses. So they came specifically looking to detox from that, lifestyle and keep her health, like she mentioned, and stay in tip-top shape so she can continue doing all the things that she loves to do. So we went with the EBOO III protocol, which is our heavy metal detox. So it includes the foot bath, a chelator that's going with the EBOO, and then you have all of the benefits of just the EBOO itself, being the ozone, oxygen, UV lights, all in one package.
So. Cattle ranch and hay, grain, cattle, horses. My family's been in rodeo for 5 generations since the early 1900s. And we have always competed in rodeo. And we started out competing, and I think I was 8 years old. And I've been training, selling, raising horses my entire life, still am. It's really important to be healthy and fit. And when you compete at our level, which is the top level against the best in the world, I rodeo every weekend. We see the white line on our big rig down the road for hours and hours every day. And mainly I just want to be, alert enough mentally, physically, vocally to do what I do. It takes a lot to be on the road that much, and sleeping in different locations every night, riding extremely high-powered barrel racing horses that are bred to run really fast and turn hard. I am 66 and a half years old, and I want to keep doing this for at least 10, 15 more years, and I think it's important to take care of myself, or I won't be able to do it. Health is what it's all about.
Have you tried any other therapies here?
I'll have to have Stephanie fill you in on all that, all the names. Yes, we have.
Yeah. Yeah. So along with Mary Ann, she brings her husband along for the ride too. So they have done all kinds of different modalities here. You did the VEMI,
Yes.
correct? Yeah. So that's one of our popular modalities, and so you liked that. Felt good after that. Have we gotten Barry on that? I don't think so yet.
I don't think so.
We'll have to wrangle him over there. So he's a good sport.
And we're doing the metabolic booster.
Yes, you do our metabolic booster injection. They do that every week that they're here for their EBOO to help with increased metabolism, increased energy, boost for B12. You did the hyper T sauna once.
No, I haven't done that.
No,
that was my sister.
Your sister did it. So,
she really liked that.
It's a whole family affair. Yeah. I had them all in one room last week. So the sisters and both husbands are great clients here and have tried a lot of the modalities.
So what would you say to somebody who is on the fence about investing in EBOO therapy or their health right now?
Personally, I really feel it's important to take care of yourself before the problem rather than after the problem. I would rather spend the money prior to getting sick and not get sick or catch some type of a disease than after the disease and then you're already sick, because it's going to cost a lot more money if you do get it, whether you have insurance or not. And it stops your life. We want to go on and live life to the fullest. We plan on living to 100 and enjoying our life.
Yes.
How old were your parents when they were still doing the rodeo?
They were in their 80s. And they took care of themselves. And so it's important. Age is just a number. It's all about how you want to take care of yourself and how hard you want to work at it and what you want to invest into your health.
This is just the beginning of their journey here with us. They did become members of our direct primary care. So I also act as their primary care provider. And so we will continue to peel back the layers of the onion and work looking at her health journey from a functional view and just keeping her in the tip-top shape that she's already achieved just on her own, and doing the things that she knows is beneficial for her body, movement, clean eating, all the things, and just keep moving in that detox pathway, helping get rid of the junk that, we're all exposed to.
One thing I would like to add is anyone thinking about coming here is that, and I've told many people this about this clinic and all the people that work here. So many times you go into the doctor and you feel like you barely get in, you're only in there half an hour. You don't really get to tell them everything that's going on, and they don't really solve your problems. We're here from 9 o'clock in the morning until 3 or 4 at night, and they are here all the time asking us questions, talking to us. I can't stress enough the personal touch and personal care, and they're truly invested in you. That's what impresses me the most. We are about 4 hours each way to get here.
They spend a lot of time on the road,
yes,
but it's awesome that
Yeah.
they put the commitment in to get here to do this.
Okay, Steph, so explain what is going on right here.
So this is the ionic foot bath that helps to further remove the heavy metals that we are kind of kicking out with the chelation that's happening over here. Chelation is a process of using a substance to bind to metals and minerals to help the body excrete them. This is another way that we're using it as excreting. This bath will change colors depending on what we are pulling and detoxing from. So everything from heavy metals, mold, parasites, those kind of things.
Well, until I started coming here, I didn't realize what all your body kept in your blood and stored in your blood.
For you.
I had no idea that all this stuff was in me until I started doing the research.
Yeah.
So it's really good to get it out.
The time that I get to spend with my EBOO patients is some of my favorite, because we have this one-on-one time, and an hour or more, give or take, and we just get to chat the whole time and learn about each other and what brought them here and their health journey and what they've been through along the way. It's a really cool process to see that healing go from when they first find us to 3 or 4 or more EBOOs later, plus our additional modalities that we have. So if you're interested in finding out more about the EBOO process, give the center a call here at Evergreen Factor. You would book a medical consult with myself. We go over your health history, medication, supplements, goals, find which protocol, because we have 4 different protocols that would be best suited for you. And then from there, we schedule your EBOOs and get you going. So it's a pretty smooth process, and we can get you scheduled pretty quickly.